There are 1.3 to 4 million biopsies done every year in the United States. Okay, it's a lot. And 240,000 men are diagnosed. So that means we have in excess of 8-9 million biopsies that are negative. All right, so you say, okay, they're negative, you can rest assured there's nothing there. Wrong. You biopsy these people because there was a reason. And that reason sort of went away, but it didn't when the biopsy was negative. And so there's all that sort of looming thing about, should I rebiopsy the patient? What are the parameters? PSA going up, abnormalities, things like that. So we need a test to help us determine who really needs to be rebiopsied. And there's one called Confirm MDX. And what that test does is it looks at that we know methylation is a way that our body controls our DNA in a way. So you methylate DNA that has to do with your ears so they don't grow, regenerate, things like that. And methylation also is good and bad. It's a way to control DNA, but it's also a way to silence things that prevent cancer and stuff like that. So what's been shown is that a cancer cell may actually, this methylation may extend beyond the cancer to a surrounding halo that actually can be detected. So what these methylation tests do is they look for DNA changes in normal tissue on a biopsy that potentially was around the cancer. So what you do is you take the paraffin blocks from the biopsy, they're sliced, and they're evaluated for methylation. And there are 3 genes that are looked at. And the power of this test is if this test is negative, none of these genes are methylated, then you have a 90+% positive predictive value that you don't have cancer, which is very reassuring for a lot of people because they don't. And so you may prevent rebiopsies and things like that. So it's a very helpful test. And even in the ones that, and we're looking at this right now, the ones that the test was negative and they actually did have cancer, the majority of the cancers that were discovered were low grade and maybe you wouldn't want to treat them anyway. So this is a good test. This is one that has an unbelievable reach in prostate cancer.